Go Fight is an oncology physical therapy clinic located in Covington, Louisiana that is anything but clinical. Founded and run by Dr. Joyce Callais, Go Fight focuses on body mechanics to address the loss of mobility, loss of balance, debilitating fatigue, and potential neuropathy or loss of sensation in the nerves that occurs uniquely in cancer patients. Oncological physical therapy involves working with patients from the start of their cancer diagnosis through treatment and after recovery.
My name is Joyce Callais, but I go by Jen. I am a PT. I'm also I have a fellowship in manual therapy. I'm actually one of the few board certified oncology physical therapists in the country. And I'm also a lymphedema therapist and a pelvic floor therapist. The reason why I have all these designations is because focusing on oncology rehab, you really need to kind of broaden your scope of practice so that you can treat like all the conditions that get thrown your way.
Jen's many designations make her one of the only PTs in Louisiana performing oncology rehab. Some patients travel across the state for help with pain and mobility.
We realized there were a lot of cancer centers around here, and at that time, oncology rehab, and it still isn't, unfortunately, like a thing. You see PTs that do oncology in hospitals, but you don't really see them out in the public, but the reality is 85% of cancer survivors are walking among us. Really, we're probably one of the only outpatient oncology clinics along the Gulf.
There is a particular need in Covington, Louisiana for oncology research and physical therapy because it finds itself adjacent to the 85-mile stretch along the Mississippi River between Baton Rouge and New Orleans nicknamed Cancer Alley. This region is lined with petrochemical plants whose pollution significantly raises risks of cancer diagnoses near the Gulf Coast.
It's very easy to kill cancer with radiation. You give any type of cell enough radiation, it's going to die, right? Jen's practice really deals with side effects of all treatment. Radiation therapy for one thing, for one type of modality, radiation and surgery. There's a lot of side effects that have the potential to limit the mobility and the quality of life for patients, and Jen's practice really addresses that.
Mike Miranda and other specialists at Mary Bird Perkins regularly refer patients to Jen's practice.
So generally, we'll use breast cancer as an example. So breast cancer is treated very commonly with chemotherapy, surgery, and radiation. And what happens with those patients is they have the tendency to have lymphatic issues post-treatment, where the lymphatic drainage in their arms start to swell. They start having issues with bringing their arms above their head. The therapeutic treatments that Jen does increases the mobility of their arms. Their arms are usually what the problem. For example, if you have a breast cancer on the left breast and you're getting treated, that left shoulder, the shoulder is the most complicated joint in the body. People don't realize that. And so the shoulder and the skin and the scar tissue, everything gets really tight. The drainage of blood, the drainage of lymphatic fluid, everything changes in that. And so Jen's technique allows to regain the mobility post-treatment as they had post-surgery.
With Jen at the lead, patients, survivors, and other PTs organize events that give back to the community. A community room holds borrowable items like wigs and other clothes in various sizes. Their big event, Survivor Share, takes place once a year, garage sale style, but all items are free for patients.
You see a lot of little wins.
Yeah, you see how they, they come in on a walker, barely able to tolerate, even standing up to move. And then, by the end of their therapy, bye, they couldn't even lift up their arm, and they, they're running out, they go shopping with their daughter that they weren't able to do before.
Yeah.
So, the doctors are saving their lives. We're helping them live them.
Ooh, that was good.
Right? That was good.
Mahjong Mondays, chair yoga, and support talk groups all exist thanks to survivors who have chosen to give back. Each of these efforts strengthens the network of support at Go Fight, proving that cancer care is a shared, ongoing commitment.
You do need a lot of family support, and it really does kind of take a village sometimes. So I guess in the beginning, I kind of did get people all across the gamut, but now I actually feel like I'm seeing the actual population of survivors because they're out in the community, They want to go to the gym. They want to be able to play with their grandkids. They want to be able to, just go to the grocery store and not have to come home and sit,
Yeah.
Just make it through their day. They want to be able to do laundry. I mean, it's little things like that we kind of forget, that we take for granted.